Well, good morning, everyone. We're gathered here today on the territory of the signatories of Treaty 7, and I acknowledge the Métis people who share a deep connection to this land. I'm joined here today by Kristen Buck, a paramedic, by Dr. Brendan Flowers, and by our leader, Rachel Notley. Appreciate everyone joining us here in Banff today to talk about an issue that's been growing more and more serious in communities across Alberta, and that's unfortunately reduced access to health care. The UCP's fight with doctors, combined with the exhaustion of dealing with COVID-19, has led to a severe staff shortage, causing emergency room closures, service disruptions across the province. Most recently, a month-long cancellation of obstetric services in Whitecourt, and ER closures in both Ponoka and Athabasca. There have been 50 ER closures already so far just this year. There are dozens of communities in Alberta where the hospital is partially closed due to staff shortages. In Hardisty, the emergency room has been closed for an entire year. We've also seen a growing shortage of ambulances and paramedics, particularly in communities outside of major cities. The UCP government has broken trust with health professionals. And instead of repairing it, they fired the president and CEO of AHS, Dr. Verna Yu, a well-respected doctor and a leader in her profession. Instead of focusing on patients, the UCP is too focused on their own leadership drama. They're too busy fighting amongst themselves to help Albertans get a family doctor or make sure that we have enough paramedics on the road. Albertans need a government that's focused on them, not on its own internal drama. Now, to say more, I'd like to invite our leader, Rachel Notley, to provide some remarks.
Well, thank you very much, David, and also thank you, Kristen and Brendan, for joining us here today. So we're here in Banff today, and we're here to raise the alarm. The Bow Valley needs doctors urgently. The fact is, last month, the Bow Valley Primary Care Network, their PCN, notified the public that the doctor shortage had reached a critical point. As of now, there are no doctors accepting new patients in Banff, in Canmore, in Lake Louise, or in Morley. Zero. And that means more families who simply don't have access to the care that they need right here in the Bow Valley. Now, there are a few reasons for this. There have been some retirements in the area, and there have also been some concerns at the same time about the cost of housing. But those are challenges that, quite frankly, can be overcome. What is harder to overcome is a government that is not supportive of doctors, that is actively fighting with doctors, and frankly, fighting with each other. The Bow Valley PCN, Bow Valley PCN Dr. Kendra Barrick cited, quote, struggles with our government, end quote, as one of the key reasons that physicians don't feel supported to work here and across the province, even in one of the most beautiful parts of our province. So we can do better, and the fact is we must do better. Now, Alberta's NDP believes that every Albertan should have access to a family doctor in their community. You know, last night, I was out on the doorsteps talking to people who live in this community, and I met several families who'd recently moved here, one with several young children. And I can't imagine how nerve-wracking it would be to have young children and not have a family doctor who you could see regularly. The fact is, these are the kinds of real-life consequences that some of the actions taken by our current government are producing, and they need to stop. The UCP fought with doctors throughout a global pandemic, and now it's everyday families who are struggling to find proper health care. I'm also very concerned to see that Alberta's medical schools are reporting dozens of vacancies in their family medicine residencies. And this means that we're not replacing retiring doctors, even with young doctors who already live here in Alberta. So this problem for Albertans and for the families who can't access family doctors is made even worse by the crisis that we're seeing here in the Bow Valley in relation to ambulances. In many Alberta communities, locally based ambulances are getting pulled into larger cities, leaving their communities unprotected. Now, Albertans have been raising this alarm for a long time as well, particularly in this community and neighboring communities, Airdrie, Cochrane, and of course, right here in Banff. Fact is, we need more paramedics, but incredibly, what the government is currently doing is fighting with them in an effort to cut their wages. So, what can be done to make this better? Make this better for Alberta families? Well, first of all, we have to end the fight between doctors and their government. We have to have a government that is willing to re-engage with local partners, including the PCN and the town councils here in Canmore and Banff. And when it comes to ambulances, we have to stop the attempts to cut the wages of paramedics, start treating them as the professionals they deserve to be treated like, and working with them on practical solutions to the problems we're facing. Excuse me. I promise you that an NDP government will act to support properly our doctors and our paramedics who are working on the front lines, like Kristen and like Dr. Flowers, to make sure that every family throughout Bow Valley and throughout the province of Alberta has the health care they need. So thank you, and I'd like to now to invite Dr. Flowers to come up. He's a longtime physician in Canmore to offer his comments on the crisis that we're experiencing.
Thank you, Rachel and David, for inviting me to speak about the importance of primary care in our beautiful Bow Valley. My name is Dr. Brendan Flowers, and I'm one of the family doctors at Mountain Maternity and Family Medicine in Canmore. Like so many, I fell in love with Alberta while completing my residency at U of C in 2014. And I have now spent several wonderful years serving the patients in Canmore and the Bow Valley, and I absolutely love it here. But the last few years have been very difficult. COVID, of course, has put a significant strain on the health system. Costs to operate a clinic have continued to increase, and with more retirements, that increased workload is falling to fewer physicians. Shockingly, we have lost 10 physicians over the past 3 years, even as our population continues to grow. As Rachel said, there are no physicians currently accepting family patients at the moment. And sadly, I am one of them. This is deeply concerning because I believe everyone deserves timely access to a physician within their home community, not in an urban center nearby, but within their home community. Physicians want to be partners on this, but we need some help. First, we need the uncertainty gone and a proper contract, put in place. As physicians, there is a definite sense of mistrust and frustration with the UCP government, and this has and will continue to affect our community health. I have already watched one of my colleagues close her practice because of the uncertainty caused by the UCP terminating our master agreement. The simple truth is, uncertainty for physicians means uncertainty for patients. And without clarity and trust, physicians will continue to leave. Second, we need to look at costs. Most people don't recognize that although healthcare is publicly funded, it is privately administered. Our clinics are a small business like any other that need to cover expenses such as staff, rent, and supplies in order to remain viable and continue to support our community. As an example, since no Canadian graduates are available to work here, our clinics could look internationally. But that means being charged tens and tens of thousands of dollars before that international doctor would even start work. These fees fall to our clinic without any support from the PCN or AHS. And finally, I believe that everyone needs to be a part of this recruiting effort. MLAs, town councils, the PCN, but also every member of our community. If you know a physician looking to relocate, please reach out. If you're not sure how or if you can help, please also reach out. Right now, this needs to be a grassroots effort, in addition to being a provincial priority. We live in a world-renowned, incredibly beautiful location. You wouldn't think it would be this hard to recruit physicians here, but it is. Banff and Canmore are not the only places with these types of shortages. I know that Cochrane is incredibly short as well. The scary reality is that wait times will continue to increase. More than half of our physicians are already burned out and thinking of decreasing their workloads for their own mental health. And as Rachel mentioned, residency spots have gone unfilled at U of C. This all means there will be fewer physicians in the future. These are complex problems, but they need a focused solution. I am pleased to join Rachel Notley today to ask for help and to ask for more focus on families here who need care. Thank you.
Well, thank you very much, Dr. Flowers. I'd now like to also invite advanced care paramedic Kristen Buck to speak. Kristen has 12 years experience saving lives in this region, but she also has some deeply troubling data that she would like to share. Kristen.
Good morning, and thank you for inviting me to speak about EMS problems in the Bow Valley. My name's Kristen Buck, and I have been a paramedic for 12 years, majority of it spent working in Canmore and Banff. I first came to the Bow Valley almost 20 years ago, and now raise my 2 young children here. I'm speaking from my perspective and do not represent any organization today. EMS in the province of Alberta is in crisis. Despite the implementation of the 10-point plan, many communities are still struggling with ambulance availability. We know this is the case in Canmore, where we haven't met response benchmarks for 911 calls for the last 5 years. There were 133 patients in 2021 who saw a delayed response within the town of Canmore. Just a couple of weeks ago, a patient with a serious heart condition had to wait 33 minutes for an ambulance, as reported by the Canmore Fire Chief. I believe this to be a threat to public safety, requiring collaboration and action. After gathering some data through the FOIP process, the top concerns are staffing. Canmore has gone from having to shut down an ambulance 3 times in 2019 to 32 times in 2021. One of the ambulances in both Canmore and Banff are Core Flex. These ambulances become out of service after 14 hours of work, further decreasing ambulance availability. These crews respond from home majority of a shift, contributing to delayed response times. As recorded in the full-time crew members' telestaff calendars who work in Canmore, this ambulance has become out of service for 8 consecutive hours at least 48 times last year. This is underreported for both Banff and Canmore. Inter-facility transfer volume. Canmore ambulances did 613 IFT last year, and only 17% were emergent and needed to leave immediately. The remaining transfers end up removing an emergency resource from our community for hours at a time, often regardless of coverage. By not addressing the issues in metro centres, the surrounding communities will continue to struggle. Solutions do exist in the Bow Valley by ending the Core Flex staffing model. Our community shouldn't have to wait an extra 15 minutes during their emergency for the crew to respond from home. Having the Canmore CT scanner available 24/7 to reduce the transfer volume, and having an appropriate transfer service the Bow Valley, as there are over 1,000 patients who need transport to a metro hospital every year. Thank you for your time.
Well, thank you so much, Kristen. It's clear we have real challenges here in the Bow Valley, both with family physicians, with our paramedic service. And we need a government that's going to make investments in our public health care, bring stability to improve the situation. The bottom line is we need better. The people living in this region deserve better health care. So with that, I guess we are happy to take any questions you might have.
Thank you, and we'll go to the phones. Just a reminder to press *9 if you're joining us on the phone, and the raise hand function if you're joining via Zoom. If you can say your name and your outlet at the top, we'll go to our first caller.
Hi, I'm assuming that I'm first. This is Stephanie Thomas from CTV News Calgary. This question is actually for Rachel Notley, and it has to do with the utility cutoff timeline. I understand that between October 15th and April 15th, utility providers cannot shut off power to those who are in arrears in their bills, but that day is coming soon, and it is cold out, and I know that for many Albertans and those living in Calgary that bills are so high and that it's a struggle to keep on top of it. So I wanted to ask Ms. Notley what she would recommend happen in this case.
Well, let me just start by saying we have heard from so many families across the province who are deeply worried about this because of the spiraling utility costs over many, many months. They have unpaid bills. You know, they're working on their bills, but in many cases they've got a lot that they haven't been able to catch up on, and they are hearing from their utility providers that they will be cut off, and they're worried. They're worried that they won't be able to keep the heat on. They're worried they won't be able to keep the lights on, and you're absolutely right, of course, is that April 15th, it's quite cold out right now. Frankly, I don't think anybody should ever have to worry about losing their utilities in this province, but certainly right now, it doesn't make sense. That's why we proposed a bill that would change the law ever so slightly, that would so that at least for now, because we have such out-of-control utility bills pressing in on Alberta families, that we would extend the ban on utility cutoffs so that it went from April to October. So that, utility companies could still seek through a variety of other means to collect the payments they're owed, but that families didn't have to worry about having their kids wake up in a cold house one morning because the utilities got shut off. That just isn't the way things should be in this province.
And as a follow-up, what discussions have you had with the UCP government then, and is there an ongoing dialogue for action on this?
Unfortunately, so we raised the matter in the House. We had a draft bill. We brought it into the House and we said, listen, we can work together to pass this bill in one day. We've done that once before with a different issue, and we could make this happen. They unfortunately told us they weren't interested. They told us, unfortunately, the minister responsible said that there really weren't that many utility cutoffs in most years, and it shouldn't be a problem. Of course, what they're failing to acknowledge is that, frankly, any utility cutoff is a crisis. But also, because utility prices have gone sky high since they've taken the cap off of utility rates, and since they've failed to bring in an effective rebate program, that families just can't keep up right now. And so they're in crisis. And so that's where you need your government to be standing by your side to make sure that these basic services are protected, because in this province, as I say, we can't afford to have the heat suddenly go off. We just can't.
We'll do another pass for questions. Press *9 to ask a question if you're joining us via the telephone, and the raise hand function if you're joining us via Zoom. And seeing none, that's all for today. Thank you.
All right. Thank you.
All
right. Thanks, guys.
Very well spoken.
Thanks so much for watching. And to learn more, check out albertasfuture.ca.